back with the Dr. Oz Show. Now, you know we're aired all over the world in over 100 countries, including China, where I've been many times. And so we're going to answer some of your biggest questions. And we're going to do it in Mandarin. We're going to focus on your health and your nutrition because I've got so many members of the audience who are comfortable. So we are visiting China today. Who's got a question? Come on in. And I actually have Dr. Daniel Xu, as well as a good friend of mine who practices in the city. So, ask away.
女生最关心的就是皮肤，那怎么样可以让我们有最年轻、漂亮、美丽的皮肤呢？
All right, so you contribute, but I'm going to start off with this animation. Come on over. So the skin is like a trampoline, and it bounces the way it does because it has all these elements beneath it, the hair and the like. But inside, under the skin, there are these collagen fibers like this. And they have elastin collagen, and they have a bounciness to them. And when we destroy these collagen fibers from smoking or bad air or whatever, we develop these big folds that many people call wrinkles. And those wrinkles are especially evident around the mouth and around the eyes as we age. So we need to be able to put moisturizers inside on our skin and under the skin in order to allow those elements to survive. But many moisturizers don't do that, so you have to pick the right ones. What do you find useful?
我觉得最好是不要晒太阳，对不对 ？So keep out of the sun. It's very important.
Okay. Thank you very much.
Thank you.
All right. Come with Dr. Xu back. The next question from our audience, please join us. How are you? What's your question?
我是想请问一下啊，人体常常会发炎，就是像我也会常常有那些炎症，然后抗氧化剂能够帮到我们什么？
All right, so inflammation does a lot of things. You can hold the mic. I have a little demonstration I'm going to use for you. And you might find this interesting. You can stand to the side here. So the body needs a little inflammation. And we use it to protect ourselves from infections. But sometimes if we have too much, and especially if we're eating the wrong kinds of foods and we're not protecting ourselves by taking the right antioxidants, which are the nutrients found in many of the colorful foods, the oxidation process from eating the bad foods causes this. And this inflammation starts to grow really big inside the body, and it begins to flow out of us. And we will see these signs in places sometimes like joint pain, but also we get problems that are life-threatening. We get problems with our heart plaques. Some people believe cancers might be influenced by this as well. So the oxidation, which causes inflammation in many conditions in the body, this has an antidote. It's to take those antioxidants. We can find them in vitamins. We can find them in healthy foods. But when we don't do it the right way, we end up with a situation that's toxic. And Dr. Xu, I don't know if you, in your practice, have techniques that you find useful as well.
Well, 我们觉得你最好的是少吃这个消炎的药啊，对不对？消炎的药对你这个肝脏不好。So that's the taking antibiotics.
Thank you, Dr. Xu. Thank you very much.
谢谢。
I'll send these off.
你是讲胀气嘛？
对，胀气。
We get another question. Come on in. How are you?
I know we're going to refix it.
How are you?
Yeah, good. Thank you. So my question is, 我的问题是，我们大家都知道，纤维很重要。那为什么这个纤维是重要的？我们从哪里可以得到一些纤维呢？
Is that a big problem in China? Constipation?
Yeah, 我想是的。
Okay, come on over.
Okay.
So, fiber does more than keep you regular. And I'll have a little animation. When you eat the right kinds of food and they go into your stomach, when you have enough fiber in the food, either the supplement or in the food itself, the fiber, this ball, picks up the little sugars and proteins and toxins, things that are cholesterol in your body, and carries them through the stomach into the small intestines, and it goes through the small intestines and slowly begins to drop off some of the sugar that it needs to, but it carries a lot of the bad things outside the body. So it allows your intestines to be clean, but also allows your blood to be clean. And that's one of the reasons that when we don't have enough fiber, which for men should be about 37 grams, and for women maybe 25 grams of fiber, we are not going to be able to live at our healthiest. And when we look around the world, that's often what we find is the most effective path. How do you get fiber in your diet?
你要多吃素菜，少吃肉。
Okay.
这样子。
All right. Thank you.
Thank you very much.
Thank you
I
very
appreciate it.
much. Thank you.
Thank you.
Thank you.
We have another question here. How are you? I hope you're enjoying the trip around the world. Hi.
就是现在就中国、美国，像我的婆婆， 我的朋友都有糖尿病，那么怎么样可以减少糖尿病的发生，帮到他们？
So diabetes is a big problem all over the world. The interesting thing is in places where they have gotten aggressive in treating diabetes, and these programs have been very successful, in more than half the cases, they can either get people off medications or much lower medications. So when it's an epidemic, as it is becoming in China, it is these types of programs that can make a big difference. There are excellent ones, for example, at the Cleveland Clinic. There's some at my university. I'm at Columbia University. But across the world now, these small little clinics are beginning to learn the tools, the secrets to helping people avoid diabetes, a disease that's like broken pieces of glass scraping the very thin lining of your artery. And by using these tools, some of them will help you lose weight. Others are based on smarter eating. In addition to losing weight, you'll get rid of the diabetes in many cases. I hope that's helpful. Thank you very much.
Thank you.
The next question, go ahead. How are you?
太好了，你好，我想请问一下，我有一个很大的肚子，我怎么听说可以用蛋白质来调整我的体重？怎么来调整我的体重呢？
How does
谢谢。
protein help? Here, come on over here. We'll show it from over here. Sure. So this is an animation that we made that shows the stomach. Dr. Shu, come with me.
Sure, of course.
And so if you look at how the body digests food, here's the stomach over here, right? And the food goes into the stomach. If it's a lot of protein, as it's getting absorbed, as opposed to sugar, as the body mixes it up, it pulls some of these substances across the lining of the intestines, these thin little villi, I call that, along the intestinal wall. They absorb the nutrients through the wall, and they get into the bloodstream. There's the blood cells. And these nutrients, when they go into the bloodstream, if they're high in protein, seem to send a message in the hormones up to the brain saying, I'm full. That's why including protein in your diet is so valuable. And it's one of the best ways, one of the best ways for us to get people to lose weight sustainably is to make sure there's a lot of protein in their diet in the morning. Okay. Is that what you tell your patients as well?
Absolutely, you said it very well. 他讲得太好了。
谢谢。
Thank you very much.
Thank you.
Next question. I think we got one over here. We've got a question about the intestines, I think. How are you? How are you? What's your question?
我想问一下，很多人的胃会胀气，就是这个胀气是怎么来的？
Oh, where's the gas come from? I have just the right demonstration. I saved this for you. So I have trouble taking these across borders, but you'll need these purple gloves, so put them on. You'll enjoy this. And Dr. Shu, if you can hold that. That is the intestinal tract. Now, have you ever seen intestines before? No. No. So this is the small intestine. You can hold that. And then this is the big intestine. You see how it's larger? And so if you can, here, I'll hold this. Dr. Shu, run to the other side and hold that for me if you don't mind. So the colon is wider, it's bigger, and the small intestine is thin. So the stomach is up here, the mouth, stomach, and then the small intestines all the way through until you get to the large intestines. And when you make gas, it happens because this part of the intestine, the small intestine, doesn't absorb enough. And the big part of the intestine gets too much food in it. And the bacteria begin to digest the food. And when the bacteria go potty, caca, they make gas. So this begins to swell up. What's the word for caca in Mandarin?
Caca.
Caca.
No, just kidding.
Caca. So,
Papa.
What is it?
Papa.
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 Papa. All right, so you don't want to have, so you want to be able to get the gas out either by allowing it to go, which everyone has to do, or by eating foods that don't make too much gas. And especially when there's a lot of bloating that happens, which is frequent, it becomes a complication. I hope that's helpful.
Thank you.
Thank you.
Thank you.
You can stand the other side, maybe you can. How are you?
Hi, Dr. Art，你好。
你好。
我是一位退休的麻醉科医生因为大家都很怕得到心脏病，我现在请教 Dr. Art 医生就是说心脏病的主要原因是什么？如何预防 ？Thank you.
Is he a doctor?
Oh, yes, I heard. So you asked about the heart?
Yeah.
So I think I have
The
I have two hearts here.
cause.
And hearts are,
How to prevent.
yes, and how to prevent. So this is what the heart looks like. And a normal heart's a small heart. But when the heart has had damage, it grows and becomes swollen like this. So instead of lifting these up, I decided to bring you a plaque, a way of demonstrating how we can prevent the heart from growing too big and getting damaged. So if I can have the plaque, And this plaque will demonstrate what happens from normal to not so normal. So hopefully ours is here, right? Nice and big, and you can see through this. And then slowly we develop blockage. Most people, even in China, by the time they're in their 20s, probably have a little bit of plaque. A little bit. And then in some cases, that gets worse, and then finally gets completely blocked off here. So when it's worse here and getting really bad here, the question is, what makes this dangerous? Interestingly, it's not this plaque. It's not just the plaque here. This gooey stuff, you can see here, this gooey stuff is only part of the problem. It's when this gooey stuff breaks and it ruptures and flies to other places, causing, for example, a stroke, or sometimes this gooey stuff actually suddenly explodes and blood fills behind it. And when that happens, you end up with a situation where you have plaque that is ruptured, and that causes sudden death. So the best way to prevent this is to reduce inflammation in the body. So by taking antioxidants, we find benefit in some cases, but most importantly, eating healthy foods. Right. Foods that calm the inflammation, the healthy oils in particular, instead of saturated fats, and of course, avoiding the big belly fat. Right. Is there a problem with belly fat that you're seeing among your patients?
Yes.
Why don't you describe to everybody, you can do it in Mandarin, what you're seeing is the biggest epidemic in China?
如果吃了很多的那个不健康的食物，那将来那个血管就会阻塞，像刚才 Dr. Oz 医生告诉我们的，将来的话呢，就是会，如果这个破裂的话，就引起心脏病的大发作。好，感谢。
Thank you very much. Dr. Shu, anything to add?
He said it very well.
I would shake your hands, but I have plaque on them.
Thank you so much.
Thank you. Appreciate it. Well, thank you. You're very kind.
My pleasure.
So what's your question?
我的问题是那么眼睛呢是我们心灵的窗户，可是在我窗户外面挂着这个非常不舒服的眼睛，一挂就几十年。有一次我去游泳的时候，结果被浪冲走了我的眼镜，我差点游不回来，想起来都很后怕。所以我不希望所有人再发生类似的事情。所以我的问题是，我们怎么样可以保护我们的眼睛和我们的视力？谢谢。
谢谢。So I'll dust that off. You can hold that. You'll need that. I built you as present. This is a contribution from my show to my friends in China.
Okay.
So, this is a big eyeball.
Wow.
And maybe the biggest eyeball, but I use it to teach because you realize if you look in there, there's lots of things happening.
Yeah.
But the best way for me to do this is actually to walk you through an animation.
Wonderful.
To answer your question about the eyes. So come on over.
Sure.
In my family, and this is common in Turkey, where my family is from, but it's also common in China,
yes.
There's something called macular degeneration. So this is the view we all want to have. A beautiful mountainous view.
Yes.
So what happens in macular degeneration is that if you look inside the back of the eye, right?
Yes.
The eye has the ability to focus and not, but inside, here's the nerve that sees. But inside here, you can get damage to the cells, the retina, where you actually see color. And these can become big splotches of injured areas, and this central area dies. So what does the image look like? The middle part begins to disappear. So if you're looking and you can't see the middle of what you're seeing, that worries me about macular degeneration. High levels of antioxidants and zinc seem to reduce this by up to 25%. So we give people beta carotene, 15 milligrams. Vitamin C we give them 500 milligrams, 80 milligrams of zinc. These are things ophthalmologists, eye doctors actually are prescribing now to help their guests because we don't want to have this. Now, obviously, the lenses themselves are an issue because we have a lot of cataracts now in all parts of the world.
Absolutely.
Some believe it's because of sun exposure, but the beauty of cataracts are that they're very easy to fix. So
good to know.
Good to know. But if you don't realize you're losing your sight, especially among parents, they'll start to fall away. They'll stop being so involved in community, and then you think that they're not so sharp. But in fact, they're very intelligent and still completely aware, but they stop interacting. Same thing with ear issues.
That's very helpful.
Thank you for your question.
My pleasure. Thank
Dr.
you.
Shu, thank you very much. I want to especially thank my trusted sponsor, USANA, who have brought this all to fruition. And I look forward to talking to you many more times, especially at all the big meetings where I know so many of my friends from China travel to meet with us. Take care.